Start, sir.
Good morning, all. On behalf of Loknete Rajarambapu Patil Ayurvedic Medical College, Hospital, PG PhD Institute and Research Center, Islampur, I, Dr. Amit Anil Chingade, proudly invite you for today's national webinar on Sthoulya and skin disorders, organized by Department of Kayachikitsa. I welcome today's guest speaker, faculty members, UG PG students, PhD students, and interns. I also welcome our respected Dean, Dr. Virendra Minkire sir, our PhD director, Dr. Patil sir, our PG director, Dr. Pramod Kanap sir, our hospital in charge, Dr. Vishal Patil sir, Deputy Superintendent, Dr. Deepali Chingade madam. I also welcome our director, Mr. Sandeep Yadav sir. I also welcome and thanks our founder, Mr. Nishikant Bhosle Patil Dada, for his guidance and support throughout. Now, I request our HOD, Dr. Sonal Shah madam, to introduce our today's first session guest speaker. Over to Dr. Sonal Shah madam.
Good morning, all. I welcome all for the today's session of webinar on Sthoulya and skin disorders. Our first speaker, Dr. Bhairav Kulkarni sir. He has a vast experience in Ayurveda and he has been rightly said as the shining star of Ayurveda. To introduce our first speaker, it will take a long time. In short, I am giving his introduction. He is the professor and HOD of Kayachikitsa department, Dr. Ved Prakash Patil Ayurved College and Research Center, Jalna. He is the director of Shri Siddhavinayak Ayurved Panchakarma Center, Aurangabad, India, practicing pure Ayurveda consultation and treatment from last 15 years. Thousands of patients are treated through Ayurveda. Tremendous results in chronic diseases like diabetes, osteoarthritis, obesity, infertility, spine and joint disorders at Sri Siddhavinayak Ayurved Panchakarma Center, Aurangabad. In past years, he has visited Sri Lanka, Cambodia, Dubai, Malaysia, Thailand, Indonesia, Spain, Portugal, Nepal, and China. He has worked as a speaker in online international webinar and seminars at Argentina, Brazil, Korea, Japan, Italy, Switzerland, Canada. He has been invited as Ayurveda guest speaker for promotion and propagation of Ayurveda through international conferences and keynote speaker. He is the organizing committee member, session chair, and co-chair. He has published more than 33 research articles in peer-reviewed journals. He has been facilitated by 14 national and 24 international awards due to excellent work in Ayurveda field up till now. He has been awarded Dhanvantari Award by Baidyanath Ayurved Private Limited, Nagpur, Teacher Excellence Award, Best Research Excellence Award, Best Ayurveda Practitioner Award. He is the Shining Star of India in Ayurveda Field Award. Recently, he has been facilitated Ayurved Maharshi Award for his outstanding work in academy as well as practice by Ahimsa, Spain. International Ayurved Icon Award by Honorable Health Minister of Maharashtra State, Ayurved Ratna Award 2022. He is honorary member of World Research Council, advisory board member of Hungarian Medical Foundation, Hungary, and scientific committee member of World Spa Organization, Italy, member of European Ayurved Association, member of Ayurved Vyaspeeth, member of NEMA, more than 10 associations in mainly Europe, USA, Asia. He is the member of editorial board of 5 international journals which are published worldwide. He was the ex-dean of Ayurvedic Medical College and now working as the professor and HOD in Kayachikitsa department in Jalna. I welcome you, sir. I request you can start with your today's webinar topic. Thank you.
Thank you, respected Dr. Sonal ma'am, and may I thank you, Honorable Trustee of Ayurveda College, Loknete Rajarambapu Patil Ayurvedic Medical College. I am very thankful, Honorable Nishikant Bhosle Patil sir, who is a founder of your college, and also I thank you, Honorable Principal sir, and your team of organizing this national webinar. So I don't waste any time, so I can start my presentation. Can I share my PPT?
Yes, sir. You can share now.
Is it visible to you all?
Yes, sir. Just start the slide, sir.
ईयरफोन मिलेगा क्या मुझे?
Okay.
Okay, so you can start now.
So, welcome all of dear students, respected faculty members from Department of Kayachikitsa. It is honor to me to introduce myself with you all. Myself, Dr. Bhairav Bhimrao Taushikar Kulkarni. I'm a BA MS MD in Kayachikitsa, working as a professor and HOD Kayachikitsa Department, Dr. Ved Prakash Patil Ayurvedic Medical College, Jalna. Also practicing it Sambhajinagar. So today's my topic, management of Sthoulya, obesity. So this is very essential to all of the PG students and UG students. Why I select this topic? Because nowadays, due to fast food, junk food, and stress, obesity is more common disease in worldwide. So that's why I choose this topic. So already organizer introduced myself, and this is some brief introduction about myself. So, dear friends, obesity. So everybody knows what is obesity. It is the specially refers to an excessive amount of body fat. So overweight refers to an excessive amount of the body that include your muscle, your bone, fat and water. Also, Ayurveda mention Medo Mansa Ativruddhi Chala Speaker Udara. It is mentioned in Ayurveda also. It is the most common metabolic disorders of human and one of the oldest documented disease. In India, early 1050 BC, Charak described, our Charak, Acharya Charaka described it under Medo Roga. So meaning of disease state Roga, the adipose tissue, Acharya Charak's description and explanation of the disease and the treatment, how to treat this particular disease. It is very well mentioned, Acharya Charak. As per reference, Acharya Charak, it is an individual disease. It increases your adipose and muscle tissue makes patient hips, abdomen, breast, and whole vitality in much less than the body size. Should be called one whose fat tissue is disease or it's obese, my dear friends. So everybody knows BMI. You are all medical students. all knows what is a BMI, body mass index. So it is one of the tool estimate a screen for overweight and obesity in adult, in children. BMI is defined your weight in kilograms. It is divided by height in square meters. BMI is related to amount of fat in the body. Also, high amount of fat can risk many health problems. So it is the one of the tool. So here I mentioned one of the chart. You just see this chart, 18.5 to 24.9. It is the normal or healthy weight, my dear friends. If your BMI is 25 to 29.9, you are overweight. If 30 plus your BMI, then it is obesity, my dear friends. So this is the particular BMI chart. I have only 1 hour, and this topic is vast and most common. So I want to explain in a brief and to cover lot of things in my session. You know very well the prevalence of this particular disease. It is more than 1 billion adults overweight, at least 300 million of them clinically obese. As compared to CDC report, 72 million people, that are more than 1/3 of US adults, and 16% of US children are obese. So according to 2017 and 2018 National Health and Nutrition Examination Survey, it is known as NHA-NES. So nearly, my dear friends, 1 in 3 adults, 13.77% are overweight. More than 2 in 5 adults, 42.4% have obese. About 1 in adult, 11 adult, 9.2 have obesity. It's a very serious problem, my dear friend. It is the figures from 2017 and 18. About 1 in 6 children, ages 2 to 19, 16.1% overweight. 1 in 5 children, adolescents 2 to 19, 19.3% have obese, my dear friend. This is some ratio over here. So this is particularly causes of obesity. You all the Ayurveda students and known everything about causes. In our Ayurveda mentioned avayam, lack of exercise. Then diva swap, sleeping at the daytime. It's a very bad habit. Shleshma ahara, sevana, intake of foods which increase your kapha dosha. Due to above factors, the anurasa means it is the end product of your digestion. It becomes sweet or not getting properly digested, and thereby result in the accumulation of sneha. So it is known as accumulation of sneha. It is known as fat. So genetic factor, one of the cause. Environmental factor like a lifestyle, behavior. Then it is in lifestyle, behavior, diet, physical activity. Social factors means poverty and lower level of education. Cultural factor, type of food, way to cooking. Then disease like hypothyroidism, Cushing syndrome, you know very well about these type of diseases. Or is PCOD, drug like steroids, antidepressant drugs. This is some common causes are mentioned here. So a person due to excessive accumulation of muscle and fat of the body present with a sagging their butts, their abdomen, their breast, and the muscle and the fat tissue are nourished and form normally, and the energy level also are normal, it is called as Sthoulya and obesity. So after that, particularly, this is the particular health risk. We can go through about this type 2 diabetes, heart diseases, stroke, high blood pressure, high blood cholesterol, then CA colon, rectum, prostate, CA gallbladder, uterus, then cervix or ovarian diseases, osteoarthritis, gout. These type of diseases, these are the health risks. So reproductive problems in a woman, including menstrual is also one of the health risks. So obesity and Meduroga, obesity, I think mute your mic, please. That's it. Organizer, leave the mic. Thank you. Obesity, regarded as a Meduroga, it is the disorder of Meda Dhatu, adipose tissue, and fat metabolism. One of the undesirable constitution, Sthoulya, Santarpanajanya Vikar, you know very well. It is over a nutritional disorder. You also know this particular disease. So, Ati Sthoulya has defined as a person who, on account of the inordinate increase of fat and flesh, it is distinct with pendulous, buttocks, belly, which already I described you. These are some causes. So, in Ayurveda, before I explain these causes, I want to explain about how to correlate with our Agni. So, effect of Agni with obesity, I want to explain with our students. So, it is the relation between Agni due to blocking of fat tissues. Vata dosha is increased within your kosta. Kosta means an alimentary canal, you know very well. Vata influence the Agni and leads increase your digestive fires. This leads your patching of foods. This leads your quicker digestion of food, also forcing the person long and food include your bridge to eating, my dear friends. So overeating, one of the dietary cause, frequent food and intake of digestion of previous meal. So in this case, Acharya Charaka well mentioned over here, Ama Vruddhi. Ama related complications are there. So according to Charakacharya, Madhav, Vijay Rakshit, Madhav Nidan, everybody mention about Ama. So about Ama, complication mentioned uncontinuous kapha increases foods, the Agni gets weakened and resoluted Ahar Paka becomes Madhura by resulting Ama. So excessive consumption of food, heavy food, cold diet, uncontinuous food. So excess use of oily food with a fried, you all eaten some type of food like some Chinese, some bakery products. These are causes of obesity, uses of sugar cane and jaggery preparations, all type of chocolates, excessive use of rice, wheat, milligrams. This is particularly mentioned. And I also want to explain about mana. Only Ayurveda science explain about man over here. So man has become a victim of civilization, my dear friends. So obesity clinics are everywhere, all gyms in a most particular metropolitan cities. One of the big fad, I'm going to gym, I'm going to gym. I want to myself as a slim. So it's a fashion nowadays. So gymnasium, body trimming, garages are open everywhere. And it rise your big money because people are disseparate to get back and body dimension and body configurations. So in a state believing trusting anything and anyone rather than themselves, many times it is too late before people start working ourselves. So being for overweight a social cause and embarrassing for many patients. So many obese people are kind of builded and developed suicidal thoughts also. I show one photo over here, a person who eating more, who is fat. So that type of burden, if uh, you are in a social particular situation and somebody, lots of people are thin or well maintained and you are obese, so your thoughts become very different. So some suicidal tendency in much more patients. So it is not only a disease, it related to your increase in a body calculations, my dear friends. So obesity also put our life in a trouble by pulling into the vicinity and wide area of complications. So stress of the accumulated, it is a bad in your body also. So ati chinta, Ayurveda mentioned ati chinta, it is a sign of obesity, my dear friends. Causes of obesity, lifestyle behaviors, also maintain mental cause, ati chinta, lack of thinking, anxiety, anger, genetic factor, bija sambhavat in mentioned in Ayurveda Sanhita. Irrespective of diet, person is obese due to genetic makeups. This is our samprapti pathogenesis causative factor, kapha meda dhatu vruddhi, amarasa, excessive meda kapha. This is the particular pathology or samprapti of Ayurveda mentioned in Ayurveda science. After that, may I want to explain about Ati Sthula. So Ati Sthula, a person who is too obese, you know very well, and in Ashtonindati Purush, heart is under trouble in those who obese or overweight. So keep in mind, when you treatment on obese patient, keep his heart, keep his mind, and treatment you need to must treatment on their heart and mind also. So in Ayurveda perspective, Sthoulya and Megaroda. So hypercholesteremia. It means excess of cholesterol, bad fat in the bloodstream. Hyperlipidemia, abnormally high concentration of fat or lipid. These terminology you also heard in most of the particular cases, most of the recent practices. This terminology, patient suffering from hyperlipidemia, patient suffering from hypocholesterolemia. So these are some terms. So Ayurveda correlate Sthoulya and Medaroga for these type of terms. So before the treatment, I want to explain a preventive measures. This is our treatment, but before this, I want to explain preventive measures. Because preventive measures is must in the field of Ayurveda. We are Vaidyas. we want to keep health of the patient. Swasthasya swasthya rakshanam first. So keep away overeating. You know very well this is the very first term. Keep away from overeating. Get induced and regular daily exercise. At least 2 to 3 kilometer walk need every day. Diva swap, avoid a diva swap. Then avoid calorie and a rich diet delivered from carbohydrate and fat like a potato and all these things. So in particularly Ayurveda, Shamana treatment means medicinal treatment are mentioned, Shodhana treatment, Panchakarma treatment are mentioned. So you can use as a Vaidya, you can use these type of treatments, Vamana, medicated vomiting. In Vamana therapies, you can use some Kafagna Dravya, Virechana, it is very effective. It is beneficial to reducing your weight. In recovery from fat included also heart elements also. In particularly woman and virechana basti treatment, before treatment we can do udvartana, snehana. Snehana means in particularly snehana you can do ruksha uh, dravya like a udvartana. So kotam chukyadi churnam, trifaladi churnam you can use for ruksha udavartan. So udavartan known as a powder massage. It is a widely practices in most of the clinics. Basti, one of the best treatment, Lekhana Basti. Lots of Lekhana Dravya use in particularly Basti, Rakta Mokshana, bloodletting treatment, Dhupanam, medicated smoking, Swedanam, herbal steam therapy, Udvartana, I already told about this particular all type of Ushna, Tikshna, Gunatmak, Dravya we can use for the Udvartana, Trifala, Musta, Haridra, Nimba, Daru Haridra, Tulsi, mustard, Lodhra, Vacha. We can use these type of drugs. And particularly, Shamana Chikitsa, it is pacification therapy, it is diet, exercise, and lifestyle. Use of particularly purgent and astringent, dry, hot, sharp, scalping qualities. Particularly, I mentioned over here, Trushana Adi Churna. It is very beneficial in the treatment of Sthoulya. Trishan know very well Trikatu, Trifala. It contains Trifala, Chauvichitrak, Vidanga, then Bakuchi, Sendav, and Somvarchana. So, Guna of Trikuta or content of Trikatu is a Maricha, Pimpali, Shunthi. Trifala, Amalki, Haritaki, and Bibitaka. It is very effective. And doshas balancing, very good cleanser, purify your blood, reduce serum cholesterol, reduce the plaque formation in the particular arteries, and it protect CVD. Also, it generally reduce your blood glucose level. Trifala is very good medicine to control your obesity. Vidanga Churna, Emblia ribes. It is a Vata Kafagna, anti-stimulating. It reduces your Vata. It is a diuretic. Is my screen is visible?
Yes, sir.
Okay.
Hello.
Yes, sir.
Sir. Is there any issue?
My screen is visible, sir.
No, sir.
Wait, sir.
उद्या किती विद्यार्थी आजचं 17 18 14 गैरहजर आहेत सांगून गेले सर परमिशन दिले आणि काय काय 2 विद्यार्थी बिना परमिशन गेले कोण कोण आहेत
Now is visible, sir.
Yes, sir.
Okay. I think some network issue from my side. Okay. Now it's perfect.
Yes, sir.
So I already explained about Trifala, then Vidanga. Some yoga therapy is very effective in the treatment of obesity. During the first week, we can start the following asanas. Ekapada Uttasana. Make a total 8 rounds, 4 rounds with each leg elementary. Then Uttana Padmasana, 4 rounds daily. It is very effective. Second week, you practice with particularly Bhujangasana 4 rounds, Shalavasan 4 rounds. This is very effective. Third week, you can Santula Asan 6 rounds, Pavana Muktasan 6 rounds. It is the one of the effective asana. You follow this rule as per this first week, second week, third week, you will get the result with a Ayurveda treatment, Panchakarma and Yogasana. It is very effective and very beneficial for you, my dear friends. And fourth week, Surya Namaskar, 4 round, Dhanurasana, 4 round. Dhanurasana is a very hard asana. So let's practice, then you can get the results. Fifth week, Ardhavakrasana, Paschimottasana, 4 rounds, 4 rounds. Sixth week, Supta Vajrasana, then Matsyendra Asana. Each asana you can do 4 rounds. Vamana, classical Vamana treatment, Virechana treatment, purgation, Snehana oleation therapy. We can use some medicated oil for Snehana. Also, for intake, we can use some type of Gruta, Abhyanga. So, one of the best treatment, Abhyanga. So, these are particularly treatment and mentioned in a Panchakarma, Snehana, Svedana, Basti treatment, Lekhana Basti, one of the best treatment to reduce your Meda, Udvartan, powder massage. So, diet to avoid milk, it's known as Pathya, milk with a fish. Then all type of meats. Don't use a curd. Sour fruits. Fruit salad, one of the dish is very famous in Maharashtra or any state. So don't use a fruit salad. Don't mix fruits with a milk. Egg with milk, meat, yogurts, melons, cheese, fish, bananas, bakery products. These are products you want to avoid if you want to lose your weight. Tamasic foods is mentioned in Ayurveda Samhita. So, processed food, canned food, frozen food, beef, fig, fishes, then egg. This is buffalo milk. Also, it is the Guru Ahar. So, don't use a Guru Ahar. In Ayurveda, mentioned exercise. Stop dieting and start moving. Means stop dieting. आप कम खाना है और ज्यादा चलना है. Walking, swimming, running, cycling, it is the best medicine. Also control your diet. Yogasana, already told you, Surya Namaskar, Pavan Muktasan, Uttanasan, already I told you about this. Particularly, we can advise our patients, wake up before 6 a.m., take a 2 teaspoons of honey, 2 teaspoons of lemon juice, 1 glass of water. Then cook daily with a love and care. Boil water, because cook daily with love and care. Why I explain over here? Because already I told you about man. Man is an important role in obesity. Your mind is cool and calm and you eat properly, then it will be good for your health. If you are in a stress condition, you take with watching a television, some news, and you eaten something, so this is not good for your health. It create obesity, it create armor. So your mind should be cool, and your cooking, at the time of cooking, you cook with love and care. For dinner, eat and 1 dish meals, vegetable, lentil soups you can take before a meal. Eat only after digestion of previous meal. This is the very important note, all of you. Keep the regular timings of meat. Eat mindfully. Already talked with this point. Fasting 1 day, fasting in a week is a good. Nowadays, it's a Chaturmas. So most of the people eating once in a day because the climatic condition. So bigger the belt and smaller the life, my dear friends. Before I stop my presentation, it can be correlated with lipid to modern science. Some factors present in your human body is a vasa and majja. Also rebels with your lipid. So medu dhatu is very important, and it plays significant role to develop your various metabolic activities, my dear friends. So excessive meda, prameha occurs. Hyperlipidemia correlated with the medoroga in Ayurveda, you know. So hyperlipidemia is one of the major cause of cardiovascular diseases. So, my dear friends, keep away from these type of disease. Bigger the belt, smaller the life. This is the slogan of today's lecture. Some patient I treated, one of the photo before treatment and after treatment of the patient, result after 21 days. I did some Kayachikitsa, after that Lekhana Basti. This is the result of the patient, or photograph of the patient before treatment and after treatment. Any queries or any questions you can, this is our Sri Siddhivinayak Ayurveda achievements. If any queries and questions, you can email me on particular my email ID. And I again thank you, the organizers and all the team from Ayurveda College Islampur, who invite me and such a great platform with eminent speaker Dr. Saurabh Deshmukh sir, who is one of the presenter with me after that lecture. Thank you. It's an honor to me. Invite you, all of you. Thank you very much, all the students or the UG students and PG students. Thank you very much. Thank you.
Thank you, sir. If anyone has questions, you can comment.
Is it good to eat twice or you have to eat every 2 hours?
Sir, one question: is it good to eat twice or intermittently eating?
Sorry, sir. Please repeat again, sir. Please repeat again.
The diet plans, there are two diet plans. Like one is saying that you have to eat twice a day only, and one is saying you have to eat intermittently after 2 or 4 hours. Which will be the better to follow?
Good question, sir. Sir, the diet is depend on Prakriti. We all the Ayurveda faculties, Ayurveda students, we all are Ayurveda students, sir. So, Vata, Pitta and Kapha, these are particular doshas. And as per Prakriti and as per their body weight, you can eat. Okay. If some people who are suffering from any cardiac disease, any particular diabetic disorders, so their diet plan is different than Swastha Purush. But one keep in mind, you can eat when previous meal was digested. This is the first rule.
Yes, sir. Okay. Thank you, sir.
Thank you.
Sir, one question is there. Hello.
Yes, sir.
That sir, if Shodhan is not possible, is Shaman play important role in obesity?
Yes, sir. Shaman playing an important role, but a patient, lots of patients are not willing for Panchakarma treatment because of time, because of their habits. Okay. So you can treat the patient with a Shaman Chikitsa, use their Ushna Tikshna Dravya, Katu Tikta Vipak Dravya, along with your diet plan. You give them Lagu Ahar, you ship them a Lagu Ahar, Deepan Pachan Ahar, and with Shamana Chikitsa. It is beneficial, but it will take a time. And daily intake, lukewarm water, daily exercise at least 3 kilometers per day, daily cycling. This is the beneficial tools along with their Shaman Chikitsa. Also cycling, swimming is very helpful with the Shaman Chikitsa, sir.
Okay, sir. Thank you. One more question, sir. They want to know about Lekhana Basti. So please, sir, explain about Lekhana Basti.
Okay. All the Tikshna Ushna Dravya are mentioned in a Lekhana Basti. Mayur Tutha is one of the ingredient in a Lekhana Basti. Gomutra, Shilajatu, we can use in a Lekhana Basti. Particularly Ayurveda Sanhita, Lekhana Basti, one of the tool. 8 days Basti Karma, first Anuvasan, then Niruva. In this Kram, we can give the Basti. But some patient who want to lose their weight and they are suffering some any other diseases like osteoarthritis, like their fat and constipation. So you can give 1 Anuvasan, 2 Niruva Basti, then 1 Anuvasan, then 2 Niruva Basti. This is the plan for 8 days. This is very beneficial for them.
Okay, sir. One more question. How Udvartan play role in treatment of Sthoulya? What is the role of it? How it affects?
I can't understand, sir. Please repeat.
उद्वर्तनाचा इफेक्ट कसा होतो त्याचं कारण
ओके.
काय आहे?
सर, उद्वर्तनाचा इफेक्ट आपल्याला कळण्यासाठी सगळ्यात महत्वाचं आपल्या शरीरामध्ये जी पोर्स सांगितलेले आहेत, शरीरावरती जे पोर्स असतात त्यामध्ये ज्या ठिकाणी स्वेदोवस्त्रुतस आपल्या ठिकाणी सांगितलेलं आहे त्या ठिकाणी उद्वर्तन हे वृक्षणाचं काम करतं आणि वृक्षता हवी असते. एक्सेसिव्ह स्वेटिंग असलेल्या रुग्णांमध्ये आपल्याला उद्वर्तनाचा रोल अतिशय उत्तम आहे. आणि आपल्याला ओबेसिटी मध्ये सगळ्यात महत्वाचं दुर्गंध हा प्रकार असतो. जनरली पीपल using some deodorants and all these things. So udvartan is very beneficial these type of situation or these type of conditions, sir.
One more question, sir. Can we advise Takrapan for these patients?
Takrapan.
Can we advise Takrapan?
Yes, takra is a ushna gunaatmak. Takra is a
Yes, sir.
ushna gunaatmak. Dadi is a shita and takra is a ushna gunaatmak. Okay, it's a role of takra is a deepan pachan, but you can use the takra in a daytime, not in a evening time.
Okay, sir. Yes. Okay.
Takra with a lavana and some type of maricha, shunthi, you can use with the takra or coriander with the takra. This is very beneficial. In Maharashtra we call it as a mattha. It
Yes,
is
sir.
very beneficial.
Yes, sir. Okay. So thank you, sir. Now I request Dr. One more question, sir. Sir, for how many days we can do the university? How many settings we can do for it?
Sir, in my clinic particularly, I give this type of basti as per method, 1 Anuvasan, 2 Lekhan. I use this type of basti up to 2 weeks, 14 days is the time span, but depends on patient overweight, patient BMI, patient weight, and their physical condition or surrounding any type of associated with any type of diseases. So that type you can plan, but it is very effective. Lekhan basti is very effective.
Yes, sir. And we can repeat the settings also, sir.
Yes, sir. If patient is willing, so
Okay,
you
sir.
just prefer only basti first.
Okay, sir.
It is the very beneficial, sir. And after basti, if the season is particularly best for you, then you can plan vamana also, sir. After lekhana basti you can plan vamana. After basti you just advise them 7 days of grutapan as per our Ayurveda Sahita mentioned. Grutapan internally, udvartana, then steam, udvartana and steam for 7 days. Last day also Snehan and Svedan. If you plan 1 to 7 days for woman karma, day 1 Snehan Svedan, and that type of Snehan you plan for udvartana.
Okay.
5th day you plan for Snehan Svedan. That time Snehan Ruksha udvartana is particularly you plan. That night you plan for 1 Niruha Basti.
Yes, sir.
Niruha Basti. Then next day for no any Snehan Svedan or nothing. After that you can give woman on day morning.
Thank you, sir. Thank you for this session. Now I request.
And basti is very useful, sir. Most of the particularly if you want to practice outside India, so basti and diet plan is very effective, because the particular patient from outside India, they want to, because their diet is not like an Indian diet.
Yes, yes.
They eat bakery products, or they eat a frozen food
Yes, sir.
because of their climate. So they want our Ayurveda terms, they want our Ayurveda food, they want our Ayurveda drugs, which are used in our kitchen pharmacy.
Okay, sir.
Coriander, marich, lavanga, shunthi, dalachini. These are the best medicine for a deepan pachan, also to lose their weights.
Yes.
So spices, one of the best medicine to lose your obesity. But spice curry is very harmful.
Yes, sir.
Spice curry is harmful, sir.
Sir, which panchakarma we can use in all panchakarma we can use in foreign countries?
For
In practice over there.
outside India, sir?
Yes, sir.
Yes, sir, that's a very good question because I guide many colleges or many students about scope of Ayurveda in a globe.
Yes, sir.
Future we plan for this lecture also to guide your PG student because
Yes,
I had a previous
definitely.
I had an experience about 15 countries, Asia
Yes.
and Europe, and also I am member of particular European Association member, UK, USA. So
Yes, sir.
lots of question for this particularly. Yes, you can use a panchakarma or not, but it will depend on this country's guidelines.
Okay.
We just advise them as a counselor, sir.
Yes, sir.
We can advise the diet, we can advise the drug, only we can advise, but we did not use any detoxification treatment if this country is not permitted.
Yes. Okay.
It will depend on which country you want.
Yes,
If you want to do basti in Sri Lanka or some Asian countries, it is possible to use for Lekhan basti. But you want to practice in a particularly Europe. But this is not possible. There are centers, and their centers are known as health centers or some holistic centers are there. Some massage therapy are there. Udvartan you can do. Local treatment you can do, sir, but internal treatment, it is not permissible some of the countries because the some type of rules. I will explain later on, sir,
Yes, sir.
when we meet personally also. We
Yes,
can,
yes, sir. Definitely.
yes,
We will arrange a lecture on it for our students and PG also, sir.
yes.
Thank you, sir. Now I request Dr. Shraddha Patil, madam, to give vote of thanks.
Good afternoon, everyone. I, Dr. Shraddha Patil, Assistant Professor, Kayachikitsa Department at Loknete Rajarambapu Patil, Ayurvedic Medical College, Islampur. On behalf of Institute and entire faculty of Kayachikitsa Department, I am here to give vote of thanks to Dr. Bhairav Kulkarni sir for giving excellent coverage to the topic Sthoulya. He has explained the point like relation of Agni with Sthoulya. Preventive measures are more important in the treatment of Sthoulya. Then Shodhan Chikitsa, Shaman Chikitsa, and also importance of yoga and yoga needed as per week. Chaturmas importance that have started now, and motivating and fascinating quotes like stop dieting and keep moving, and bigger belt, smaller the life. He also shared evidence-based cases and answered well all the queries. We all are inspired by your great words, and this lightened our path in the treatment of Sthoulya. Thank you so much, sir, for imparting such a wholesome knowledge. Thank you, sir.
Thank you, ma'am.
Thank you. Correct. Hello, sir. Dr. Saurabh Deshmukh, sir. Dr. Saurabh Deshmukh, sir. Hello.
मागे इथून लागत नाहीये. तुमच्याकडे रेंज आहे मॅडम? हा. मला ओके. काय बोलतो?
Hello. Hello. Saurabh Deshmukh, sir.
हॅलो. हा बोला सर.
Hello,
काय
sir.
सर? दुसरं सेशन सौरभ देशमुख सरांचं.
Sir, तुमचा साऊंड ऑन म्यूट करा सर.
बरं ठीक आहे. बघते बघते.
Saurabh Deshmukh, sir. Hello.
Yes.
हा सर. सर तुमची स्लाइड शेअर करा सर.
हो.
तुमचा कॅमेरा ऑन करून स्लाइड शेअर करा सर.
तुम्ही मला होस्ट करा ना.
हा सर.
केले सर.
तुम्ही आता co-host आहे.
नाही सर, अजून एक जे दिसत आहे ना सौरभ देशमुख, ते पण करा ना.
दोन्हीला करू का? ओके
हा सर, दोन्हीला करा सर.
ओके, आता ट्राय करा.
विजिबल आहे?
Yes sir, it is visible. So we can start now sir. तुमचं शेअरिंग स्टॉप करून तुमचा स्क्रीन ऑन करा सर. व्हिडिओ.
होतंय.
सौरभ सर,
चालू करायचं का?
तुमचं स्क्रीन ऑफ करून शेअरिंग ऑफ करून तुमचा कॅमेरा ऑन करा सर. विल स्टार्ट विथ द इंट्रोडक्शन सर फर्स्ट. Welcome sir. Welcome on behalf of Department of Kayachikitsa, Loknete Rajarambapu Patil Ayurvedic Medical College, PG PhD Institute, Research Center. Now I request Dr. Sonal Shah Madam, HOD Kayachikitsa Department, to introduce sir.
Good afternoon, sir. Good afternoon, everyone. Today's webinar, the second session on skin disorders. I welcome Dr. Saurabh Deshmukh, sir. He is the Associate Professor and HOD of Mahatma Gandhi Ayurvedic College, Hospital and Research Center, Salud. He is the faculty member of International Psoriasis Foundation. He is expert in chronic skin diseases, neurological disorders. Also, he is the director of Sparsha Ayurved Multi-Speciality Clinic, Wardha, Nagpur. He has attended and delivered various lectures as a guest speaker on biomedical waste, cosmetology in Ayurveda, discipline in internship, that is the rules and regulations in internship, Pushta Vichar, liver health and beyond it. He has been awarded as esteemed medical practitioner, awarded by Dr. JRK's Research and Pharmaceuticals Limited in May 2023. He has written articles and published in peer-reviewed journals. Also, he has published books on Advances in Kayachikitsa, the fourth paper of PG of Kayachikitsa. He has published a book on Kushtanta, that is complete textbook on skin disorders. Also, he has written a handbook of KC. So with this vast experience of his knowledge on skin, it gives me great pleasure to welcome you, sir. I request you to start with your session. Thank you.
Thank you, ma'am. First of all, Om Dhanvantare Namah. It's my pleasure to deliver a guest lecture. I am very thankful to Rajarambapu Patil Ayurvedic Medical College, Hospital, and PG Institute and Research Center, Islampur. I am thankful to the Department of Kayachikitsa team, and special thanks to the Dr. Sonal Shah ma'am. And I am presenting in front of you on national webinar on Sthoulya and skin diseases. So today I am going to discuss on an Ayurvedic perspective on diagnosis and managing skin disorders. Myself, Dr. Saurabh Deshmukh, Associate Professor and HOD, Department of Kayachikitsa, Mahatma Gandhi Ayurvedic College, Hospital and Research Center. As we know that while treating and diagnosing the skin disorder, we have to keep some concept in our mind. So the basic concept which we have to keep in mind, which is a concept of Saptadhatus. Because when we talk about the Samprapti Ghataka of the Kushta, so the three doshas and four doshas they have explained. So we have to know the Saptadhatus, that Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra. And one more concept is very benefited while treating and diagnosing the treatment related to the psoriasis. So this is a concept of Shakha and Koshta. So all the Shakha is considered as Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra, and Koshta is the uh, body organs. So this concept is very benefit. Next, we can know that the skin anatomy, it contains epidermal layer, dermal layer, and subcutaneous tissue. So Acharyas has said the 7 types of layers that Avabhasni, Lohita, Shweta, Tamra, Vedini, Rohini, and Masudara. So they have divided in a different thickness as per the Vrihi Pramana. So Avabhasni, they have said that it is a 1/18th of the Vrihi. Lohita is 1/16th part. Shweta is 1/12th part. Tamra is 1/8th of Vrihi. Vedini is 1/5th, and Rohini is 1 Vrihi Praman, and Mamsadhara is 2 Vrihi Praman. According to that the thickness, the skin diseases will be present as per the layer. So when we talk about the Kushta, so Kushta is produced by the visheshan of Saptako Dravya Sangraha, as I said previously. That is Vata, Pitta, Kapha, Tvaka, Rakta, Mamsa, and Ambu. Acharya Charaka, he has said that it is a Santarpa Janda Vyadhi and Rakta Pradoshachin Vyadhi. Kushta has been mentioned under the Ashtamahagada by Shushruta. So Visarpa, Shvitra, Ilasa, and Shudrogas are the other kind of Tvaka but different from the Kushta. As per the dosha avastha, as said, that if it is a bahudosha avastha, we have to give first shodhana and then shamana. If there are less dosha avastha will be there, so we have to treat with them shamana we can give. So shodhana has a great importance because it removes the morbid doshas from the root cause of the diseases. Then Vamana and Virechana is said to be the Shodhana procedure. And Shamana, after that, we can adopt a Rasayana Chikitsa while treating the Kushta and other skin disorders. So the different types of skin we can find like Vataja skin, Pittaja skin, and Kaphaja skin. So Vataja skin will be a dry, clean, and cool to touch. Pitta is breakouts, photosensitivity will be there. reddish and warm to touch, and kapha will be oily, thick, and more tolerant to the sun. So these are the, as per the Doshik Avastha, Vata, Pitta, and Kapha type of skin. Next, when we say about the different lesions, when we say about it, so there are a bulla. So it is a circumcised collection of free fluid more than 1 centimeter is called as a bulla. Then macule is a circular flat discoloration below less 1 centimeter. It may be a brown, blue, red color, and hypopigmented color will be there. And nodule will be a circular elevated solid lesion. It will be called as a nodule. Patch is more than that of 1 centimeter. It will be a flat and discoloration will be there. So papule, it is a superficial solid lesion. It is less than 0.5 centimeter. Next is a plaque, very commonly seen in the psoriasis. It is a superficially elevated solid flat. It may be a more than 1 centimeter in diameter. Pustules will be a vesicle containing the pus. Vesicle is a collection of the fluid less than 1 centimeter. These are some different types of skin lesions. As per the lesion and as per the site, you can easily diagnose if you know this type of lesions. So next is a wheel type of lesion. Next is a scale. This is the epidermal thickening. Then crust is the dried serum. Then fissure, it may be a cracks or split will be there. Excoriation, it is a liner erosion will be there. Excoriation. Then erosion is a loss of epidermal layer. Then lichenification is a thickening of the epidermal layer. Scar is a thickening and permanent fibrotic changes that occurs in the skin. So these are the different skin lesions you can easily find in a different disorder while treating or diagnosing the uh, skin disorders. So as our acharyas said, the Viruddha Annapana is one of the cause. Suppression of natural urges like vomiting, etc. Having cold water immediately after exposure to the sun. Then during the Panchakarma, if you not follow the diet during the Panchakarma, it may cause the skin disorders. Consuming new grains, curd, fish, excessive salty and sour food, and black gram. Indulging in excessive exercise, sexual activity, even if the food is not digested, sleep during the daytime, and insulting the Brahmana and Gurus. These are the reason to get the if you are follow this, so you will be getting a skin disorders or kushta. So these are some other factors which are very common nowadays. That is ultraviolet rays, radiations, mithya ahara, and polluted air. And some of the mental things which is like fear, stress, depression, and anger. These are the more common nowadays for the skin problems. So when we say about the Samprapti Ghataka, so as said that it is a Tridosha Janma. Dushya will be Tvaka Rakta Mansa, Ambu, and Lasika. Srotas will be Rasava, Raktava, and Mansava. Agni will be Jatragni, Nande, Dhatvagni Nande. Ama will be Jatragni, and Dhatvagni. Adhishtan will be Tvak. Protodushti will be Sangha and Vimartana. Udvasthana is Amasha. Sancharasthana is Sarosharida. Yaktasthana is Tvak. Rogmaraka is Bahya. Vyadi Svabhava is Davina or Chirupari. So we can go to the 7 type of Mahakushta we have explained and 11 types of Shuddha Kushta we have explained. So first one is Kapala Kushta, which is Vata predominant. So this is Kapala Kushta, which is correlated with the tuberculosis leprosy. Then this is the Audumbara Kushta, which is Pitta Pradhana. So this is a particular type of Kushta resembling the fruit of Udumbara. So it is looks like a coppery red in color. This Audumbara Kushta is correlated with nodular type of epidermolysis leprosy. Next is Mandala Kushta, which is Kapha Pradhana. So this is whitish red in color. So this is a maculoanesthetic leprosy. It looks like. So for the diagnosis in these both pictures, one is a maculoanesthetic leprosy, one is a this is a ringworm. So second picture is a ringworm, and first picture is a this maculoanesthetic leprosy. So Rishijiva. So Rishijiva is Vatapittaja Pradhana, resembling the tongue of black deer. So this picture, which is below one, so this is the original picture which I get from the one of the leprosy center. So this is a borderline lepromatous leprosy. So this is the resembling the black deer tongue. This is the Pundarika Pushta, which is a Kapha Pitta Pradhana. Kapha Pitta Pradhana. So this is similar to the petal of lotus flower. So this correlated with the mid borderline lepromatous leprosy. Next is Sigma Pushta, which is a Vata Kapha Pradhana. So this also is called as a tinea versicolor. In the disease, it is discolored patches. Most of the noticeable symptom will be there. Okay? And most common site is arms, chest, neck, and back. This is for correlation. So first picture is a tinea versicolor, and second picture is a pityriasis alba. So this is very common in a children's. Second picture. Next is a Kakanaka Pushta. This is a Tridosha Janma. So Kakanaka is nothing but a gunja phala. So there will be a pus formation, painful burning sensation will be there. This type of Kakanaka Pushta is correlated with a nodular type of lepromatous leprosy. So one extra is said by the Acharya Shushruta, that is Aruna Pushta, which is a Vataja type of Pushta. So this will be correlated with an ethylene anesthetic type of leprosy. So most of all the Mahapushtas are correlated with the leprosy. And this pushta is nothing but the bunch of flowers. There will be different types of skin disorders clubbed together, and they called as a Mahapushta or Shudra Pushta. So next we will move to the Shudra Pushtas. So they are 11 in number. So one by one we will go. So this is the first Ekha Pushta. That is Swedinam Mahavastu, Makasya Shaklana. So purely a Vata Kaphaja type. So this is most of the dissertation and most of the thesis you will be getting. Ekha Pushta is a psoriasis, and some they will be said Pitika will be correlated with the psoriasis. But actual picture of Ekha Pushta is correlated with psoriasis vulgaris. So here the skin resembles the scales of the fish. Next is the Charma Pushta. This is the Charmakhan Bahulam, Charma, purely Vata Kaphaja type. So here the skin looks like a elephant skin. Next is xeroderma pigmentosum. So sickle-like macules and carotic lesions are there. So this is a Charma Pushta. Next is Pitiba Pushta, which is the Shava Tinakara Parusham Pitibam Sulatam. It is a purely Vata Kaphaja type in color, rough and hard to touch. So Acharya said this that Tinakara Sparsha, the रेती जे असतात आपण जे जेव्हा हाताला घेतो आणि जेव्हा टच करतो, it feels like a Tinakara Sparsha. Like that feeling will be there in this patient. Okay. So this Pitiba Pushta is correlated with the psoriasis. It is purely a Vata Kaphaja type. So psoriasis is a critical site you can see. Most of the types हैं उसमें plaque psoriasis, batic psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. So what do you mean by psoriasis? It is a disease of skin characterized by erythema and elevated scaly lesions will be there. Okay. So most common classical sign is well-defined, sharply demarcated lesion, round oval-shaped lesion, usually symmetrical will be there, and especially is a common. So different types of psoriasis like chronic psoriasis, chronic plaque psoriasis, Dept psoriasis, flexural psoriasis, erythrodermal psoriasis. Somewhat pustular psoriasis like localized and generalized one will be there, and local form like palmoplantar, scalp psoriasis, nail psoriasis, Kleifer psoriasis. There are different types of local form. So most of the common uh, chronic plaque psoriasis. Most of 85% people are involved this type of chronic plaque psoriasis. Feature is pink color lesions, well-defined plaques with a silvery scale. And here the pink color is a a classical sign, salmon pink. So these are the some pictures, chronic plaque psoriasis. Plaque psoriasis. Next is a Dept psoriasis. So while seeing this, you have to think about the button. You have to shirt the button like that. Only that much size lesion will be there in over the abdomen, trunk, and proximal limbs. Very small lesion below 1 centimeter in the diameter, and numerous and small. You have to find the lesion along with the plaques. So you can see in this picture also plaques will be there. Okay. So this is the Dept psoriasis. Next is the flexular psoriasis. So while treating and while diagnosing the psoriasis, you have to find only one thing, that is a scaly lesion. So in all type of lesion, you just find that site is different, but lesion are same. There will be a site difference will be there. Okay. So this is a flexular psoriasis where you will be getting in the skin fold only, like groin lesion, gluteal lesion, axillary lesion. You will be getting this type of psoriasis. So what you have to find out? You have to find out the scaly lesions in that. Okay. So in this picture, you can get some whitish lesion in between that. So next is erythrodermic psoriasis. So this is a this generally covering entire skin surface may involve slowly from chronic plaque psoriasis. Okay, and this is a very fine lesion will be there from scalp to the leg. In all over body, it will be spreading. Okay, so very minor, the minute इसमें जो जितना रहेंगे पूरे body को cover करते हैं. ठीक है. Next is the pustular psoriasis. So as I said, that it is a two form, localized one and generalized one. So localized one is the more common, and it will be a deep-seated lesion, multiple small pustules over the palm and sole will be there. And generalized one will be seen over the body surface area. Okay. So this is a type of palmoplantar psoriasis. So remember always, if you are seeing the patient which is infected in both the palm and both the sole, they are involved, then only it is called as the palmoplantar psoriasis. This is the scalp psoriasis. So in scalp psoriasis also you will be getting a different diagnosis or differential diagnosis like seborrheic dermatitis. You will be getting a tinea capitis. You will be getting seborrheic dermatitis, tinea capitis, and normal dandruff also in some of the patient will be there. But how you can differentiate scalp psoriasis? So in scalp psoriasis, first and foremost thing which I said that you have to see for the scaly lesion. Okay. So next is the nail psoriasis. So here also you can get fitting, okay, well circumscribed depression will be there in the nail surface. So in initial in the patient, you will be getting an oil drop sign. So oil drop where you will be getting a pore in the nail surface, and it looks like that oil is dropped in that. Psoriatic arthritis is also common one. Okay, so there is a patient which is having polyarthritis or like that, and along with that, where there will be a pain will be there, and that lesion only there will be a psoriatic lesion will be there. Okay, so this is the sign of psoriasis. There are three signs. candle grease sign, auspicious sign, and oil drop sign. This is the auspicious sign. Auspicious sign is very easy. So if you are removing the scaly lesions from one by one, so you will be getting a blood tinge. So that is called as the auspicious sign positive. This one, which I said, that oil drop sign. So here is some pouring that oil pour into the over the nail surface. And one more is this candle grease sign. That candle grease sign is similar to that. How you can put a candle, उसकी जो layer बनती है, similar way, psoriasis में जो lesion बनती है. If you are removing one by one, so you can easily remove the scaly lesion. So that is called as the candle grease sign is positive. If you get the after removing the scaly lesion, you are getting the blood tinge. So that is called as auspicious sign. So next is how you can score the psoriasis index. So this is a psoriasis area severity index, which is called as a PASI score. Okay. So here you can get. So you have to check for the head and neck, trunk, arms, and legs. So total percentage of you have to find out. You have to find out the severity of the redness. You have to find out the severity of the thickness. You have to find out the severity of scaling. According to that, so we have to see for this chart the severity of erythema from 0 to 100. You can see moderate, similar way thickness, mild, moderate, severe, and very severe. So you can give a severity index from 90 to 100, 70 to 80, 85, 90. You can give. Okay. So like that scaling also you can give non-mild, moderate, severe, and very severe. You can give like that. So next is the Vepadikam. Vepadikam Padi Padspitam Trivedam. So this is the purely cracks in the palm and sole. So this Vata couple of types. So plantar psoriasis, the palm and sole are involved. That is called as palmoplantar psoriasis or Vepadikam. So in this picture, so this is the first picture, which is palmoplantar psoriasis. This is second picture is also same as the pustular lesions are there. So in third picture you can see this is the pustules. So this is the type of pustulosis palmoplantar psoriasis. So there is a pustule sole called as the pustular palmoplantar psoriasis. Next is the alasaka. So it is a Vata type. There is a nodular growth will be there. So this is alasaka is correlated with the lichen planus. Very common nowadays, lichen planus. Next is the Vichurchika. Vichurchika is second to Pilica stava, the whose private Vichurchika. So there is a red pustules having itching, type will be there. So this Vichurchika is correlated with the eczema. But eczema, you can see this both the pictures. These both are the eczema only. But first picture is the dry eczema, and second picture is the wet eczema. So next is the Dadru. So I can do Ragapilikan, Dadru Mandagalam, Octagon. So this is the pictures of the Pradhana. So especially when we say about the Dadru, so this is the tinea infection. So these are the some different types of fungal infection like tinea capitis, which is there in the head, tinea fibrosa over the scalp region, tinea corporis over the body surface, in tinea cruris over the groin region, tinea umbium will be the male's region. Next, tinea barbae over the beard, tinea monan over the hand, tinea pedis over the foot, tinea versicolor over the chest and upper back, then pediculosis and scabies. This is a mild. So these are the some different fungal infections are there. So next is the Charmadala, which is a Pitta Kapha Udana. So this is correlated with the seborrheic eczema. Next is the Pama Kushna. Pama Kushna is a Pitta Kapha Udana. So this Pama is correlated with the scabies. You can see in this picture that the mite This is the mic. And ये अपने यहाँ जहाँ X क्रॉप करके कर रहे हैं, तो क्लासिकल पिक्चर आपको इस तरह का दिखेगा, जहाँ जहाँ ब्लैक स्पॉट दिखते हैं वहाँ वहाँ वो अपने अंडे छोड़ता है, तो यू कैन इजीली डायग्नोस दिस स्कैबिस. Next is the vispota. Vispota is pitta kapha pradhana. So this is correlated with the bulle. Fluid filled raised lesion will be there. Next is shatar. So it is pitta kapha pradhana. So this shatar is correlated with the pyoderma gangrenosum. It is a uncommon chronic recurrent cutaneous ulcerative disease. And I have to give it this also. So how you can diagnose this all the things related to the Ayurveda. So we have to diagnose with the help of Pratyaksha Pramana and Anumana Pramana. Of course, we can use Darshana, Sparshana, and Poshna Pariksha. Then Ashtavida, Dashavida Parikshas are there, okay, with the help of that. So diagnostic tests are there. So skin culture, you can do skin biopsy, foods like examination, endoscopy, and skin testing you can do. So Uslang examination you can do for some fungal infection. You have to see for some dark patches. You can assess by the Uslang examination. Endoscopy is you can do very easily. It's just take the glass side, clear plastics will be there. So you have to apply the pressure with the help of glass slide, and you have to observe for the vascular lesions. So most of you will be getting a petechial purpura lesion. So petechial purpura is nothing but a hemorrhagic spot in some of the diseases like ITP, like dengue. You will be getting a petechial purpura lesion. So this is a hyperpigmented lesion. Okay. And if petechiae is a small, it's less than 1 centimeter is called as a petechiae. If it is more than 1 centimeter diameter, it's called as a purpura. So treatment. So principles of skin treatment like Nidana Parivarjana, Akarshana, Prakriti Vighata is said by Acharyas. So avoid the Nidana of Kushna you have to do. Okay. So this is the Chikitsa Sutra, Vatiktareshu Satyavama, Shreshmatareshu Pushteshu, Ittatareshu Mokshu, Raktasya Virisman Chadana. So we have to take some step while treating the Chikitsa. First step, you have to do the Pradhana Dosha Chikitsa. So you know very well that Krishna is the Dosha Gandhagadi. So we have to treat the dominancy of the dosha first. Okay. And then later you have to treat the Anubandha doshas. So Acharya said for Vata, you have to take the Ritapana. In Pitta dominancy, Virechana, and Rakta Mokshana. In Kapha dominancy, you have to treat with the Vamana. Next is the Varamvar Shodhana. Kushtavyadi is offered due to the Dosha Bahulyata, and this is what Turyagami disease. So that's why Acharya said that you have to do the Shodhana for Dosha Nirhana. You have to do the again and again Shodhana Chikitsa. So first one is Pradhana Dosha Chikitsa, second one is Varamvar Shodhana, third one is Rakshana of Prana. So we have to, while treating this, and if you are doing the Shodhana repeatedly, so just see for the Puna Shodhana Chikitsa. If you are doing that, you will be aggravating the Vata Prakopa also will be there. So just think about the Bala Shaya of the person and treat accordingly. Okay, so you have to do the Rakshana of Prana also. Next is the importance of Sneha Sesha Dosha Nirana. So Snehapana should be performed in a Shuddha Kushta Avastha only. If you are giving Snehapana in Ashuddha Avastha, so there will be a Vyadhi Vardhan will be there. Okay. So Pradhana Dosha Chikitsa, Varambara Chikitsa, Lakshana of Prana, and importance of Shesha Dosha Nirana. According to that, you have to treat the patient. So this is Apakarshana, as I said, to Ritapana, Virachana, Vamana. The Panchakarma we can adopt So in Panchakarma, Vamana, Virechana, Vasti, Nasya, and Dattamakshana, people adopt. So Acharya Shushruta has said that Vamana once in a different days, Virechana once in a month, Dattamakshana once in a 6 month, and Nasya once in a third month. You can adopt as per the Shushruta Acharya. Dattamakshana. So Dattamakshana, you need to check for the Alpadosha Avastha or Bahudosha Avastha. If there is a Alpadosha Avastha, Pachana with the Labu and Shambhu you can use. Bahudosha Avastha, Shiraveda you can adopt. And Prakati Vijata is Shamana. So for Shamana, we can use the Aushadhi Pravyas, which we can get from the plant origin, mineral origin, or animal origin. So as per the Yukti of the physician, you can see the combination or single compound formulation you can use. Here are the some list of common drugs which is used skin disorder like Haripura, Tulsi, Neem, Kumari, Hadira, Savira, Manjishka, Paramja, Chakramarga, and Chandana. Some of the kashayas which will be used: Tiktakam, Mahatiktakam, Patol, Muladi, Kudichadi, Aragudadi, Patola, Patu, Rohinyadi, Vidula Tiktakam Kashayam, Manjishkadi Kashayam. You can use Nimbadi Kashayam, Sukumara Kashayam, Indikansa Kashayam, Amritsakara Kashayam, Vasa Kudichadi Kashayam, Asanadi Kashayam, and Aragvada Amrutadi Kashayam. If you have to treat the lesion where there will be a lesion with a shota, using Punarnavadi, just give the Punarnavadi Kashayam along with that. You will be getting a good result. So some of the ghritas you can use: Tiktakam, Mahatiktakam, Kalyana Tiktakam, Vigula Tiktakam, Kashayam, Shakadot you can use. Then Kadirarishta, Arakudarishta, Ushirasam you can use. Nimba, Amritarasava, Sarivadhyasava, Dhandarasava, Gumutrasava, and Mulikasava you can use in different skin disorders. So next chunas like Nimbadi chuna, Haridra Khanda, Vipula Pancha, L.R.P, Ayurvedic chuna, Rajarambapu chuna. This is very used in a Kerala side. Next, some of the Butika you can use Bilvadi, Yushi Vishari, Shri Dharavasa, Arugavardhan, Gandhaprasad, Badi Bukuli, Shira Bukuli, Sapadavati. Rashanga we can use. Some of the Tailas like Marishadi Taila, Ailadi Taila, Alpamaradi Taila, Panchavalkadi Taila, Kinda Taila, Durvadi Taila, then Durdur Patradi Taila we can use. Nimba, Shira Bastar, and Panchavalkala you can use for the Bahara purpose. And not more than that, but you have to, after Shodhana or after Shamana, you have to take the help of Rasayana for evergreen and rejuvenating the skin and other things. Okay. Shodhana or after Shamana, you can prescribe the Rasayana. So some of the healthy things which the skin, body, and beauty needs, like hair massage, body massage, Ayurveda bath in Masya. Then you have to do the exercise, yoga, meditation, sattvic ahara, and sound sleep is must. Some of the cases which I will be discussing. Okay. So this is a 67-year-old male patient. So this is the lesion which he has having. Whole body is involved with the flaky lesions. Okay. So this is the chronic plaque psoriasis patient. So we have adopted the classical Ramana we have did. Ramana Virechana we have did. So this is the Beacon patient we have looked at. Constricted Bruta. From starting dose of 30 ml to 60 ml. Baya Svena and Baya. So we have did. And after that, Pashyadakarma, we have Dimopana and Sasera, we have adopted. The Shamana Aushadhi is like 100%, we have given. There is subsurrected, which is prescribed by me. That is a Shabnam Company Private Limited, Hyderabad. They contained Saxoria capsule, Saxoria oil, and Saxoria lehan. Kayachikitsa Ghurtam I have given, and Gomutra Arka I have given to the patient. You can see the release of the patient after that. So 0 day to first month to second month and last 6 months you can observe the lesion which fully vanish. So similar in the back you can see in the third month and after 6 months you can see that picture. All the back is removed from on the. So this is one rare patient that is rheumatoid psoriasis. This is also treated successfully. So in severe type of rheumatoid psoriasis, you can see the second picture, which is very severe one. This is a rheumatoid type of psoriasis, very rare type of this psoriasis type. So this is a one more case of that is a W Bushra, which is a Pinia cruris. You can see in the first picture and last picture, it is fully recovered from all the complaints. So next is a palmoplantar psoriasis. You can see the first picture and last picture. For this picture, for this patient, we have given only a Chikitsa, not any Shodhana procedure we have adopted. So this is also one type of W Kushna. So in this patient also, we have treat with only pure Shamana Chikitsa, no any Shodhana procedure we have adopted. This is flagella psoriasis. You can see in the first picture. And after that, fully recovered from that complaint. This is the one vitiligo patient. You can see the spot over here, and after the treatment, it is fully vanished. This is a one type of W Kushna. You can see over the back region. It is there. It is fully recovered from the sign and symptom. This is the one type of carbon cell. Okay. So over the neck region, you can see with the help of some Shamana Aushadhi and Jalopracharna, it is fully recovered from the complaint. This is tinea only or fungal infection before and after treatment. Only Shamana Chikitsa, it is fully recovered. This is a Vicharchita, which is a contact dermatitis. So patient is a history in a chemical factory he is working. So with the help of that only, he has got the contact dermatitis. After treatment, Vamana we have did, and after treatment you can see the result. This is the one type of acute fully recovered from the lesion. This is a phytophotodermatitis, where when she will be going to the sun exposure, she will get the lesion. So this is a phytophotodermatitis. This is a, as I said, this is a dry eczema. So after treatment, it is fully recovered. This is the gutted psoriasis. You can see, as I said, that very small lesions are there over the proximal limbs and over the front and back. So it is also, we have did the Ramana and Virishna repeatedly. So after that, we have get the result. This is a chronic plaque psoriasis, fully recovered from it. This is a gutted psoriasis. It is also a very clear picture now. This is also a plaque psoriasis. You can see on the lower limb. This is one of the patient which is having a vitiligo over the eyes. You can see, and for her, we have did the Vamana, and after that we have do the Shodhana, Shamana procedure. So it is fully, the vitiligo part is fully recovered from that. So this is a picture of bullous pemphigoid. It is an autoimmune disorder, and this is a one fibromatosis. This is a rare case. Okay. So my research articles, it is more than that. Okay. So conclusion that if you put definitely diagnosis if you are doing it, so you have to see for the dosha avastha also, and you have to see for the lesion identification and lesion identification and location. If you do that, you will be master in diagnosing the skin disorder. And Acharya has said that Nidana Parivarjana, Shobhana, Shamana, and Rasayana will be very benefited in while treating the skin disorder. And of course, it is a promising to treat the skin disorder with the traditional methods. Thank you. So this is my book, which is and to my guru, Dr. Dept, Patil sir. Thank you very much.
Thank you, sir. Thank you for this knowledgeable session. If any questions, please. Sir, one question is there. Lichen planus Ayurvedic management.
Lichen planus, sir.
Ayurvedic management, what we can do in lichen planus? Yes.
हा सर, लायकन प्लॅनस सर्वात पहिलं तर कसं आहे, त्याचे खूप सारे डिफरंट प्रकार आहेत. जसं लायकन सिम्प्लेक्स आहे, लायकन प्लॅनस आहे, डिफरंट टाइप्स आहे. तर कसं आहे, ऑटोइम्युन डिसऑर्डर आहे सर.
Yes, sir.
तर सर्वात पहिलं तर तुम्हाला ऑटो इम्युनिटी पेशंटचं दोष बल हे सगळं बघून घ्या, आणि ते थोडं चांगलं असेल तर तुम्ही पहिला वमन नेते विरेचन प्लॅन करा.
Yes, sir.
हा, आणि नंतर तुम्ही ऑटो इम्युन म्हणजे बूस्टअप करण्यासाठी काही असे ड्रग आहे आपले जे इम्युनिटी बूस्टअप करतील. ते बूस्टअप करायचं आणि सोबत रसायन चिकित्सा करायची.
Yes, sir. Okay.
मी ट्रीट केलेलं आहे सर, आणि त्यांचे रिझल्ट पण खूप चांगले भेटले मला. मेन आहे की लायकन जो आहे तो पसरतो. ठीक आहे. तर माझ्या पेशंटमध्ये तो जो फ्लेक्स तयार झाले होते, हार्ड फ्लेक्स तयार होतात त्याच्यामध्ये, तर ते पूर्ण लिजन एकदम स्मूथ झाले. थोडंसं जो पिगमेंटेशन असतो त्याचा काळपट जो पिगमेंटेशन असतो ते जायला त्याला वेळ लागतो, पण परत येत नाही.
Okay, sir. Sir, fungal infection, nail bed infections, fungal. What we can do?
सर,
Fungal infection, nail bed.
नेल बेड साठी जनरली माझ्याकडे जे पेशंट असतात सर, मी त्यांना पोर करायला लावतो. जसं जे आपले तेल सांगितलंय मी काही, त्या तेलांमध्ये त्यांना 5 ते 10 मिनिटं तेलामध्ये बुडून ठेवायचं मोस्ट ऑफ टाइम. आणि कसं आहे की नेलचं एकदा इन्फेक्शन झाल्यानंतर रिकवर होणं थोडं मुश्किल आहे. पेशंटला मला सांगा, तुम्ही रोज म्हणणार की तुम्ही बुडून ठेवा, किती दिवस बुडून ठेवणार आहे?
बरोबर.
थोडं फिजिबिलिटी नसतो. पण माझे जे पेशंट आहेत ज्यांनी खरंच केलं आहे तसं, तर त्यांना रिझल्ट 2 ते 3 महिन्यात भेटले आहे.
ओके.
आणि मोस्ट ऑफ टाइमवर काय होणार की ते जे नेल सरफेस आहे ते पूर्ण निघून जाते आणि नवीन नेल तयार होतात.
Yes, sir. Sir, one more question. How to
Yes, sir.
approach recurring fungal infections in patients?
हा सर, रिकरिंग जे फंगल इन्फेक्शन आहे याच्यामध्ये मी आतापर्यंत 11 वर्षाचा माझा एक्सपिरियन्स झालाय. मी जे अनुभव केलाय की पेशंट मोस्टली जो आहे, जसं एकतर सर्वात जो कॉमनेस्ट जो कॉज आहे तो एकतर जो आपण बोरचं पाणी वापरतो त्याचा मी एक खूप अनुभव केलाय की जे लोक बोरच्या पाण्याने आंघोळ करतात त्यांना एक तर होतं. आणि जो जनरली जे ओबेस पेशंट असतात त्यांना थोडंसं तिकडे स्वच्छता ठेवायला सांगायची. आफ्टर बाथ लगेच त्यांना कपडे घालायला अवॉइड करायचे, थोडेसे लूज कपडे घालायला लावायचे. आणि जेव्हापर्यंत तो कपडा आपला ड्राय नाही होत तेव्हापर्यंत ते कपडे घालायचे नाही. थोडेसे रेस्ट्रिक्शन आपल्याला करायला लागेल. आणि याच्यामध्ये एक सुंदर जो ड्रग आहे आपला सूरशेखर रस, तुम्ही ते देऊन बघा विथिन 2 to 3. काही पेशंट जे आहे तुमचे फंगलचे ते फक्त एकच म्हणते जात. सर्वात मोठा मुद्दा त्यांचा तोच असतो. तर याच्यामध्ये सूरशेखर रसचा वापर करायचा. तुम्हाला विथिन 2 किंवा 3 days मध्ये ते पूर्ण लिजन त्यांची
Yes, sir. Sir, one more question. How to avoid pratishay during repeat frequency of hair massage and washing?
काय परत सर प्रतिशा आहे का
word pratishay during repeat
हाँ.
frequency of hair massage and washing.
प्रतिशा जे अवॉइड करायचं आहे आपल्याला
हा,
हेअर मसाज आणि
वॉशिंग आपण रिपीट करणार ना, तर
हा हा
काय होणार त्यांना ते अवॉइड कसं करू शकतो आपण?
अवॉइड करायच्या वेळेस सर शोधन नस्य करायचं ना त्याला पेशंटला.
ओके ओके.
हा शोधन नस्य करायचं आणि रिपीटेड 3 सिटिंग घ्यायची पेशंटची.
येस येस.
हा तर त्याला तुम्हाला त्याच्यामध्ये जाणीव येईल की जेव्हा रिपीटेड तुम्ही करत आहे शळबिंदूचा वापर करायचा त्याच्यामध्ये आणि सेटिंग घ्यायची 3-3, 7-7, 8-8 दिवसाची त्याची सेटिंग घ्यायची नसत्याचे आणि त्याचा डोस जो आहे तो चेंज करत जायचा. म्हणजे जसं 8 ड्रॉप्स टाकले तर 10 ड्रॉप्स टाकायचे मग 12 ड्रॉप्स करायचे. थोडं वाढीव क्रमामध्ये घ्यायचं.
ओके ओके.
रिपीटेड जो एलर्जीचा प्रॉब्लेम आहे त्याला ते होणार नाही.
येस सर, येस सर. So thank you sir. Thank you for this session. Now I request Rushikesh Jedge sir to conclude this session.
Hello, good afternoon to all. Myself Dr. Rushikesh Jedge, Assistant Professor at L.R.P. Ayurvedic Medical College, Islampur. It gives me an immense pleasure to deliver the vote of thanks for this event to all dignitaries assembled here. I would like to thank our chief guest speaker, Dr. Dept, sir, who honored this lecture with his inspirational thoughts and giving excellent courage to the points like Nidan Panchak of skin disorders, Kushka Prakar and its modern correlation and treatment of skin disorders according to Ayurveda. I would like to thank our beloved principals, staff members, students, participants, volunteers, and last but not least, our beloved audience for making this function as a grand success. Once again, I thank one and all present here for this webinar. Thank you.
Thank you, sir.
So we are posting the feedback link in the chat box. You can fill up it and to get the certificate. So thank you all.
Thank you, sir.
Over to IT sector. Thank you to Dr. Patil sir and IT department for their cooperation. Thank you.
The feedback link is shared in chat box.
Yes, sir. Okay. Thank you, sir.